Hello, my name is Lisa Thompson, and I was the chair and author of the Safeguarding Adult Review pertaining to the death of Gladys. Gladys was 85 when she passed away. She'd been cared for in bed for many years. Gladys lived in a social housing property where she had previously lived with her husband, who had been her carer. Following his death in 2013, Gladys was assessed as having care and support needs, and she remained involved with adult social care until her death. From 2013, Gladys had various family members living at her home. This included her daughter, her adult grandson, and latterly her son. Kent Police were involved throughout with all family members due to violence and abuse perpetrated within the home. Children's social care were involved with Gladys's grandson, initially as a child and latterly as a parent, as well as with Gladys's daughter, whose baby was subject to a child protection plan from pre-birth due to domestic abuse. Throughout all of the agency involvement of Gladys's family members, she was largely invisible. There was no recognition of any risks faced by Gladys, despite the unhealthy dynamics of the family unit being very well known amongst agencies for many years. Gladys was a private person. It is recorded that she was unable to read and write. However, this was not known to all of the services. It was felt that Gladys would have been unlikely to ask professionals for any help, and she always had at least one family member living with her. Gladys's GP, social workers, and occupational therapists who cared for Gladys all stated that she knew her own mind and was not afraid to speak her mind. To that end, Gladys was adamant that she did not want to go into hospital or to go to a care home. Gladys wanted to stay in her own home with her family members around her. On the day that Gladys died, an emergency GP attended the home and assessed that Gladys was at the end of her life. However, the GP noted that he was not sure whether this was due to natural causes or due to neglect. The medical cause of Gladys's death was established and recorded as pneumonia, immobility, and frailty of old age, with a previous history of colorectal cancer. The full report is available to read on the Kent and Medway Safeguarding Adult Board website. However, I'm now going to take you through a few of the themes that were identified within the review and also share some reflective questions which you may want to pause the video and think about. So first of all, the theme around Think Family. Often practitioners assume that a Think Family approach is limited to work with children and young people. However, it is also vital to think about the whole family when planning, delivering, and monitoring services for adults. Gladys was a vulnerable person, and the people living in her home were violent towards one another. And in her daughter's case, possibly towards Gladys. They all had alcohol and drug misuse issues and were well known for antisocial behaviour. The Think Family agenda recognises and promotes the importance of a whole family approach, which requires all professionals to consider family circumstances and responsibilities and linking up all services working with all members of the family. Spend a moment thinking about a family that you're currently working with, who may be presenting with complex needs and issues. Consider the following points. Have you identified the risks and or needs that each family member poses to themselves? What risks and or needs do each family member pose to other members of the family? Are there intersecting dynamics which increase the risks or needs? For example, dependencies or mental health which exacerbate one another? What supports or services or agencies are in place for each of the individual family members? And in what ways could these supports, services or agencies work together? And in what ways may they need to work in isolation? What else sticks out for you when you think of the family members as both individuals, but also as a whole unit? A second theme from the review was around informal carers. So the family members who lived in Gladys's house also provided her with care. However, this was never quantified assessed, or monitored. None of the family members formally identified themselves as carers, and none of them were offered carers assessments. Where family members or friends appear to be providing care, they should be asked about this, and the person being cared for should also be asked. Wherever possible, this should be done separately in order to understand motivation and the ability to care. Where appropriate, offers of carers assessments should also be made. Some questions to ask yourself include, do you feel confident talking to a person about their informal carers? Do you feel confident talking to informal carers about their needs? And do you know how to refer someone for a carers assessment, or how to support them to apply for a carers assessment themselves? A further theme coming from the review was around domestic abuse and coercive control. It is clear from police and agency records that violence and abuse had been happening in Gladys's home since 2014. Gladys was known to be a victim of abuse from her daughter. There is no indication that Gladys's son or grandson were physically or emotionally abusive towards Gladys. However, police and children's social care were involved with Gladys's grandson and his partner due to violence and abuse. Practitioners should be aware of the effects of violence and abuse within the family on all members of the household. This should include adults who are not directly known to be targeted. Questions you can ask yourself include, do you know who to speak to about domestic abuse in your organisation? Do you have domestic abuse champions in your organisation? And are you aware of the effects of domestic abuse within the home? If you need further training on this, do you know where to go to access the training? The final theme I'm going to speak about is multi-agency working. So this review highlighted learning around joint up working, especially across all agencies working with the different family members. There was a lack of information shared between agencies regarding possible risks within the home. Professionals working outside of social care were not aware of the dynamics within the home. Practitioners should consider if a multi-agency conversation would be beneficial whenever there is a change in circumstances or a new plan has been put into place. Spend a moment thinking about a case that you are currently involved in, which may be at a point where a multi-agency discussion would be of benefit. Consider the following. What barriers are there in starting this process? What is the first action you need to take to set up a discussion? What resources does your service have to help you with this? And what resources are available on the Kent and Medway Safeguarding Adult Board website which will help you with this? A further area of learning in respect of multi-agency working is around the involvement of social housing providers in multi-agency discussions and planning. Ask yourself, do you ask individuals that you support or work with about their housing tenure? And if you are supporting someone who's housed by a housing association, do you communicate with their housing officer as a standard part of your planning? You may read the whole report on the Kent and Medway Safeguarding Adult Board website. Thank you for listening.